Chapter 55: Sexually Transmitted Infections. Sexually transmitted infections, or STIs, is a serious public health problem in the United States despite medical advances. It is estimated that 20 million new infections occur each year, and almost half of these are in people that age 15 years old to 24 years old. STIs spread primarily through sexual contact and may have serious and permanent consequences. And this spread actually happens because some people are engaging in sexual contact, but they also resist taking preventive measurements. Infected people do not always inform sexual partners so that so then the disease continues to be passed on. And then nurses must be aware of their feelings about working with people who have STIs. We have to actually take care of patients that we are not um, being judgmental. Diagnostic tests and procedure. We do serologic testing and smear swabs and cultures. Serologic testing, these are those blood testing that is checking for specific antibodies that the body actually built when they were exposed to specific antigen. For example, HIV, right? We are going to check if there's like an antibodies. When we do those blood testing, we actually check for the antibodies that the body built and produced when they were exposed to that virus. So if you are positive for the antibodies, then that means that you are exposed or you were exposed to the antigen. Smears, swabs, and cultures. So these are your specimens that we collected. For example, maybe a discharge from the genital area. We will collect those cultures and then we will send it to the lab. And then they will check if those specific antigens are actually present. There's 30 different bacteria, viruses, and parasites that are known to be transmitted through the sexual contact. The World Health Organization, or the WHO, identifies 8 that account for the greatest number of the infections. You have syphilis, gonorrhea, chlamydia, trichomonas, hepatitis B, HSV or herpes, simplex virus, HIV, and HPV. What are the medications that we give? Drug therapy, we give them antibacterial agents, your antibiotics, if it's caused by bacteria. Antiviral is given if it's actually caused by a virus, although please remember that when we give antivirals, we actually do not kill the virus. We actually stop them from or slow the replication of the virus. Dermatologic agents, we give them some of those topical medications to kind of like um, lessen the severity of the symptoms. And then we have the HAART, which is a combination of medications that we give for HIV. It's in page 1084, table 55.1. And let's go over some of the common ones. For antibacterial agents, your penicillin G. This one is a first choice for treatment of syphilis. And what are important nursing interventions that we need to remember for penicillin G? We actually have the patient wait for 30 minutes after the injection in case there is an allergic reaction. This may be given in a deep injection in the large muscles. And when we do this, do not pause during injection. The needle may clog and then we massage the site. Ceftriaxone sodium or rocephin, another antibiotic. This one is effective against organism that causes gonorrhea. Nursing intervention that we need to remember, we need to notify the physician for diarrhea, which is one of the side effects. We report vaginal or anal itching, and then we assess bruising and bleeding. So if we're giving this injection to the patient, please make sure that we actually check for check the site if it's painful, if it's swollen after. If it is, then what we can do is we can use those warm compress, and you can place it in the site, and it actually will help with the pain and the swelling in the site. Okay, more antibiotics is your doxycycline or fibromycin. This one is effective against organism that causes the gonorrhea. And we give it in combination with the other medication, the ceftriaxone. We can also use this for chlamydia, syphilis, and granuloma inguinale and lymphogranuloma venereum. Nursing intervention that we need to remember is we assess the allergy. This is a tetracycline and to sulfites, okay? Monitor food intake and stools and assess blood pressure and level of consciousness. Please remember that when we're giving these medications for the STIs, the gonorrhea, chlamydia, syphilis, we have to actually educate our patient to delay sexual activity until they are officially cured. Okay. Okay, more. Macrolides is erythromycin. Erythromycin is effective against organism that causes chlamydial infection, syphilis, and gonorrhea. And if you recall, this is the medication that we actually give to newborn babies. It comes in as an ointment, and we put it in the eye of the newborn because we're trying to prevent eye infection. And then we have azithromycin or Zithromax. This one is effective against chlamydia. If we're going to use it for gonorrhea, we use it in combination with the ceftriaxone. Remember that this one we have to highlight. Side effects of azithromycin, only because we give this commonly. Please remember that side effects of azithromycin or your Zithromax includes diarrhea, nausea, vomiting, abdominal pain, and vaginitis. Nursing intervention, we need to take caution if the patient has liver impairment, and do not give this with antacids because it messes up with the absorption, and it gives 1 hour before meals or 2 hours after meals. Flagyl is the next one, your metronidazole or Flagyl. This one, tinidazole, is the first choice for trichomonas, while Flagyl, metronidazole, is used to treat BV, your bacterial vaginosis, and second choice for treating the trichomonas. Clindamycin is a vaginal cream, and this is used to treat bacterial vaginosis. Acyclovir, your Zovirax, Valcyclovir, Valtrex, Famciclovir, Famvir. Please remember also the side effects of acyclovir, your antivirals. Dizziness, headache, diarrhea, nausea, vomiting, renal failure, and seizures. Okay, in the next page, highlight the last one, which is the HAART or highly active antiretroviral therapy. This is a highly effective strategy to treat HIV infection by using a combination of medications, your non-nucleoside reverse transcriptase inhibitors, nucleoside reverse transcriptase inhibitors, and protease inhibitors. So again, the HART is antiretroviral therapy. It's a combination of drugs that we use for HIV infection. Reporting STIs. So reporting STIs, confirmed cases of STIs like HIV, AIDS, gonorrhea, syphilis, chlamydia, chancroid, and viral hepatitis must be reported to the local health department. What they do once it's reported is that they ask the patient to name their sexual contacts. So they do like contact tracing, and those individuals that have been exposed to the disease are encouraged to seek medical evaluation, because this process is in place because we want to identify and then treat the infected people right away so that the transmission of the disease can be slowed. All right, let's talk about those infections now. Chlamydia. Chlamydial infection is caused by Chlamydia trachomatis and lymphogranuloma venereum, LGV. This is a more invasive strain of Chlamydia trachomatis. Signs and symptoms of chlamydia, they may be asymptomatic, but if they do have symptoms, then they will have like a penile discharge, which will be thin at first and then it becomes creamy. For women, they might even have vaginal discharge and lower abdominal pain. I just want to point out, because it says signs and symptoms may be asymptomatic, and this is actually why it gets challenging on slowing the transmission of these STIs, is because a lot of them, they don't have symptoms right away. They may be asymptomatic. So the transmission can only be slowed if they have symptoms and they report it and they seek medical treatment, and then we can do the contact tracing and actually tell them, or the infected ones, that they are infected, and we encourage them to have the medical treatment. However, if the infected person is asymptomatic, they don't even know that they are infected with something, so it's kind of like challenging to slow the spread of infection because of that reason. Okay, complications is sterility in both sexes. Sterility meaning they are not able to conceive. They are not able to conceive. And then complications also include treat newborn with erythromycin ointment. So this is the reason why we're giving those eye ointment to newborns, is to actually prevent them from having this infection, because they go through the vaginal canal upon delivery. So that's why we give them the ophthalmic ointment. Medical diagnosis and treatment. So we diagnose them with what we call an AAT. Like I said, this is a type of your serologic testing, which they are actually checking if they have those antibodies, if they have been exposed, right? So NAAT is a nucleic acid amplification test, and they check if the chlamydia is actually present. Then what we do is we give them azithromycin or your Citromax. Like I said, go back to that box in page 1084 and 1085. Azithromycin is there, your Citromax. Again, this is effective against chlamydia, and side effects are your diarrhea, nausea, vomiting, abdominal pain, and vaginitis. And then after that, we can even give them doxycycline or your vibromycin. And This is a 7-day course that we give for chlamydia. Gonorrhea is caused by Neisseria gonorrhoeae. Signs and symptoms, again, may be asymptomatic. If they do have symptoms, there will be a penile discharge, which is whitish or greenish discharge, and there is a burning sensation during urination. There might be testicular pain and even swelling. For female, they may have a vaginal discharge and bleeding through sexual intercourse. There's a redness and swelling of the genitalia, external genitalia, burning sensation too during urination, abdominal pain, and abnormal menstruation. Or they may even have rectal or throat infections. Complications again is sterility in both sexes, and then it could even be more severe that it could damage the heart tissues and joints, okay, for your gonorrhea. Epididymitis, prostatitis, pelvic inflammatory disease can happen, and even ectopic pregnancy can also be a complication of the gonorrhea. There's an increased risk of HIV. So STIs and HIV, they kind of like go together, right? If there's like an STI, there's an increased risk for HIV. Okay, so complication of your gonorrhea is increased risk of HIV. Again, we give the newborn erythromycin ointment because we don't want the infection to actually infect the baby. Medical diagnosis is the same. We do NAAT and we do smears and cultures, meaning that we collect those specimen, right, from the discharge maybe, and then we send it to the lab and check if it's positive for those for the gonorrhea. Treatment, we use ceftriaxone. Again, this ceftriaxone is the uh, choice of medication effective against gonorrhea. This is an IM single dose. Okay, so what we do is we give them this injection, and then after that, we actually will give them some kind of tetracyclines like your doxycycline or vabromycin 7-day course. Okay, again, I'm going to repeat that. So ceftriaxone, we will give it like an IM or a single dose. It's like a loading dose, we call it. And then after that, we may give them those doxycycline, which is a 7-day course. Okay, then we can even give them also azithromycin uh, or your Zithromax. Syphilis is caused by Treponema pallidum. This is a spirochete or coiled bacterium. And let's talk about the signs and symptoms and the stages of syphilis. Syphilis, if untreated, goes through the process of those 4 stages: your primary, secondary, latent, and then late. So primary stage, this is when the lesion, or we call it chancre, is the first sign of syphilis. If you look at that picture in page 1089, figure 55.1, you can clearly see it. There's a chancre, and this is the primary stage of syphilis. Okay, chancre, that's a small lesion in there in the genital area, and this is usually first noticed 1 to 12 weeks after contact, after being infected. During the primary stage, there will be a reddish lesion, a papule, that appears where the organism actually entered the body. And then within 1 week, that papule becomes a painless red ulcer. This stage, the chancre may last from 1 to 5 weeks. Now, when it disappears, now patient usually thinks that they are cured, when in fact the infection actually moved from the genital to the blood. Now, secondary stage occurs 1 to 6 months after the contact. Symptoms for secondary is that they have the rash on the extremities, chest and back, palms of the hands, and then soles of the feet. Pustules that contain highly contagious material also develop. They may have fever, sore throat, and generalizing aching are also seen in secondary stage. Patient is contagious during the first, your primary, and the secondary stage, okay? Now, the latent stage is when there's no symptoms that exist after the secondary stage. What's going on in the latent stage is that the organism is now invading major organs, okay? So the infection is now inside, is infecting the major organs. So the infection is not contagious by sexual contact now, it's actually by blood exposure. Around this time in the latent stage, the infection is being spread if it's transmitted by blood exposure, not by sexual contact. Now, for the late stage, this is generally 3 years after the contact, and then the signs and symptoms of this late stage includes arthritis, numbness of the extremities, lesion on the skin and internal organs, and then pain because of the damage to those organs that it actually infected, like heart maybe, or even central nervous system. Okay, complication of syphilis, very serious, right? Your neurosyphilis. That could actually even cause meningitis, which is, the inflammation of the covering of the brain, blindness, paralysis, and even cardiovascular disease. So again, if it gets to this point and it's not treated, the syphilis is actually affecting those major organs in the body. Complications including fetal infections and may even cause deformities or death of the baby. Medical diagnosis, we call it VDRL, venereal disease research laboratory test, and then RPR, or your rapid bleed reagent test. This detects, both of them detects a protein that appears in the blood. And this is just a summary. Your stages for the syphilis, you have primary, secondary, latent, and late. Again, primary is there's a chancre, right? Chancre, 1 to 12 weeks after contact and may last up to 1 to 5 weeks. Secondary is 1 to 6 months after contact. There will be rash in the extremities, chest on the back, hands, soles of feet. There's pustules, fever, sore throat, generalized aching. Latent is when there's no symptoms, however, the organism is now invading major organs and may not be transmitted by sexual contact but may be transmitted by blood exposure. And then the late stage is 3 years after contact. If remain untreated, it could cause arthritis, numbness of extremities, lesion of skin and internal organs. We call it GAMAs, by the way. And there could be damage to the heart, blood vessels, central nervous system, and the major organs. Medical treatment is your penicillin G. Okay, penicillin G. So again, what we will do is we will give this penicillin G, which is an injection, right? It's an injection like we did talk about earlier on, penicillin G, and then we will combine it with oral antibiotic medications. We'll give the injection penicillin G, and then the patient will go home with the tetracycline antibiotic medications that they will take orally after. Herpes simplex virus, or your HSV, we have virus 1 and virus 2. Signs and symptoms of the herpes. Um, there's a rash that is followed by small blisters that eventually becomes ulcers, and the patient will also have like flu-like and burning sensation during urination. Look at this picture in page 1090, figure 55.2. That's a genital herpes lesion on the vulva and the inner thigh. You can see like those like blisters, right? Small blisters. That is manifestation of herpes. Okay. Then complications from herpes simplex virus is cervical cancer, okay, precursor of cervical cancer. If it's not treated, it could be a cervical cancer. And then also patient can have herpes simplex encephalitis. Medical treatment, there's no cure, right? There's no cure. However, because this is a virus, so however we give them those antivirals that we did talk about, your acyclovir or your Zovirax, valacyclovir or Valtrex, famciclovir or the Famvir. So nursing care for herpes, remember these rashes and the small blisters. Well, what we want is for them to actually take care of their personal items. So have or educate your patient to wash personal items daily. Trichomoniasis is caused by Trichomonas vaginalis. This is a protozoa parasite. In figure 55.3 in page 1091, look at that. It's a trichomonas vaginal discharge. It is profuse and watery and appears purulent. Okay? Signs and symptoms is there will be a vaginal discharge that looks like this. It's frothy, it's yellowish vaginal discharge with foul odor. And then there will be a slight burning after urination, or for men there will be a burning feeling upon ejaculation. Medical diagnosis, we culture the discharge. So this is the time when you actually collect the specimen, swab the discharge, and then send it to the lab. Medical treatment, we can give this tinidazole that we did talk about, tinidazole, and your Flagyl, okay? Anti-infectives, your tinidazole, Tindamax, or your metronidazole Flagyl. And what we do is we treat the patient and we also treat the sexual partner of the patient. HPV, or your human papillomavirus. There is an incubation period from 3 weeks to 8 months. And can you imagine how long that is, right? There's an incubation period from 3 weeks to 8 months. Um, what we do is that we actually have some vaccination that we offer people. It's Gardasil and Cervarix, and this vaccination is available for us to give so that we can actually prevent the human papillomavirus, or your HPV. These vaccinations, the CDC actually recommends that girls and boys who begin the vaccination series between ages 9 and 14 years receive 2 doses, and those who initiate the series between ages 15 to 26 years and those immunocompromised should have a 3-dose series of these vaccinations. Signs and symptoms, if you look at that picture in page 1092, figure 55.4, you could see what we call condylomata warts. It's like those warts that is actually showing in the genitals. Men will have these warts on the glands, on the foreskin, in the urethral opening, penile shaft, or in the scrotum. In women, it's gonna look like this. There might be in or around the vulva, vagina, cervix, perineum, anal canal, and urethra. How do we diagnose? You can easily see this. Simple observation. With this condylomata acumata warts, you're gonna see it and you're gonna know that it's HPV. Otherwise, if we want to confirm, what we do is we collect some specimen and then we biopsy it and then we send it to the lab for diagnosis. How do we treat? There's no cure. That's why we're actually always asking, as nurses, we actually recommend for people to actually receive the vaccinations so that we can prevent this HPV or human papillomavirus. And it's worse. So what we do is we do symptomatic relief. So we can actually remove those warts so that the patient can have some kind of relief. Otherwise, we can give them some medications, your podophylox, imiquimod, and cunicatecins. Okay, but again, it's not a cure. It's just a symptomatic relief because of these warts from the warts. All right, but bacterial vaginosis or your BV. This is caused by Gardnerella vaginalis and other anaerobic bacteria. Infectious bacteria emerge when normal bacteria in the vagina are suppressed. So, who are at risk? Those people that have multiple sex partners and those that are doing those douching. Douching is the introducing of those fluid into the vagina so that they can quote unquote clear it, right? Clean it. And those that are unclear if it's also unclear if actually transmitted sexually. Signs and symptoms of your BV: irritation, itching, painful urination. There's a thin gray discharge and fishy odor. We diagnosed it by sending that culture to the lab from the discharge, and then they do microscopic examination and then they could see that it's there. How do we treat bacterial vaginosis? We treat it with Flagyl, your metronidazole. It's administered orally or vaginally, or we can even give them clindamycin, which is a vaginal cream. Pregnant women, we have to actually check for bacterial vaginosis because BV can cause premature birth and low birth weight in infants. So we want to make sure that we're checking pregnant women, assessing them for bacterial vaginosis if they do have it because there's a risk for the baby. All right, now let's talk about HIV, human immunodeficiency virus infection. Again, please remember that HIV is the virus, right? Human immunodeficiency virus. This is the virus that causes the disease. The disease is called AIDS, acquired immunodeficiency syndrome. HIV gradually destroys T4 lymphocytes and which are essential for resisting pathogens, and when those T4 actually declines, the patient is now susceptible for opportunistic infections, and those opportunistic infection thrives when the immune system is impaired. It's the immune system that is ceasing to function. That's why the patient actually have the AIDS, or the acquired immunodeficiency syndrome. Okay, question one. Which of the following statements is not true about sexually transmitted infections? Answer is B. Worldwide, the incidence of STIs decreases every year. It's actually increasing every year. Question two. A chlamydial infection is usually treated with a single dose of. Answer is B. A chlamydia antigen test is used to screen for chlamydial infection. A urine test also is available. The most accurate test, though, is cell tissue culture. The infection usually is treated with a single dose of azithromycin or a 7-day course of doxycycline. All right, so when we do assessment, right, we do focus assessment, meaning what are the signs and symptoms that the patient is manifesting for them to actually seek for help. So we review the systems, especially the reproductive system, and then we're gonna see some signs and symptoms, and then we're gonna see some physical manifestations, right? And then you do the physical examination. Interventions are focused on disrupted tissue integrity, pain, of course, potential for injury, anxiety, low self-esteem, altered social relationships, impaired sexual function, inadequate coping, and ineffective management of the condition. Patient teaching for sexually transmitted infections. It's very important for us to remind the patient and educate the patient of the risks if they do not complete the course of antibiotics. So they have to complete the course of antibiotics, which means if they go home with a 7-day course of antibiotics, then they have to finish the 7-day course, even if they feel good after taking the antibiotic for 3 days. Okay, reason being is there's a risk for them to actually develop resistance to antibiotics, and the development of those superbugs that we've been talking about, your MRSA, your VRE, your CRE, right? Those are the reason that those superbugs are actually mutating, because this is one of the reason when patients actually do not complete the course of antibiotics. So very, very, very important for us to remind the patients that they have to complete the whole course of the antibiotics because of those reasons. Avoid sexual contact until they are cured. Okay, avoid sexual contact until the infection is cured and contact with high risk individuals. Condom use, we have to make sure that we're actually educating them for safe sex, to prevent the transmission of these infections. Women with herpes or condylomata are at higher risk for cervical cancer. So what we want to tell them is they need to have those annual pap smears, okay, those pap testings, to check and make sure that we catch the cervical cancer early. And then with HIV, medical treatment may prevent or delay development of the disease AIDS, and they cannot donate blood with HIV. Again, educate them with the use of those equipments that we can use to actually prevent the transmission of the infection, use of a condom, and use of a dental dam. All right.